I am the chief of the cardiovascular medicine of the University of the Philippines, Philippine General Hospital. I am an associate professor at the College of Medicine of the University of the Philippines College of Medicine. I work also as the chair of the heart care services of the Manila Doctors Hospital. I am a past president of the Philippine Heart Association and a fellow of various medical societies here and abroad. The technology right now is growing fast and more accurate. However, the problem with ECG is that it's not perfect. The reason why we correlate it with patients, it needs expert interpretation and correlation with the patient. But if the technology can incorporate already, for example, the symptoms, the signs of the patients, and what they feel accurately, and that the patient can definitely describe what they feel, if it's angina or heart failure, then maybe in the future it's going to be helpful. But my expectation is that this technology will grow, but will ultimately need the help of doctors for it to be interpreted in a safe and effective manners. Periodontitis has been identified way back in decades ago as a risk factor for cardiovascular disease. Yes, it's a sign that there is an ongoing inflammation. And cardiovascular disease is a form of inflammation. When you have an inflammation somewhere, it connotes inflammation everywhere. So it's a sign that you are having a cardiovascular disease as a risk or as a manifestation of an inflammation somewhere else. And indeed, we found out that periodontitis, and not only periodontitis, infection, perhaps viral infection, bacterial infection, can cause vascular and cardiac disease. I do agree that it is a predictor of cardiovascular disease. The next question is, can oral health or dental hygiene prevent cardiovascular disease? Cardiovascular disease is caused by multiple factors, not only the oral, but maintaining a healthy oral cavity it's not harmful, of course. It will help in at least alleviating or reducing the risk of cardiovascular disease. But it's not absolute. There has been a lot of clinical trials that were, used to regenerate the myocardium using stem cells. And indeed, it's quite promising because it really did improve the cardiac function in a lot of a series of clinical trials. Both allogenic and somatic stem cells were used in this cardiac repair. The question is the method. They really use different types of methods of applying the stem cell into the cardiac myocardium. Now, it also depends on the baseline function of the heart or myocardium before the stem cells were introduced into the myocardial tissue as well. Now, of course, the allogenic stem cells has been proven to be effective in some clinical trials. Seems like, but not in few. Somatic stem cells also has been used and somehow showed promising results. But until we can be able to demonstrate in a large clinical trial that this type of intervention can really regenerate the myocardial cells, then we cannot use them right now. There are ongoing clinical trials, but the regional trials applicability is an issue, a problem in most of the region. Duplicating this in one clinical trial is hard to duplicate or use or follow in another clinical trial. So we're still way behind, but as the word itself is really promising, and we have to wait for the results of these ongoing clinical trials. Precision cardiovascular medicine is the way of the future. It's the future. It will tell us who will benefit from a particular drug. It's going to be, I think it's going to be the trend on how doctors will treat patients and identify which medications they will benefit from. And it's going to be very useful. The problem is its applicability in a wide array of population. Again, regional. Second is economic, and the healthcare system. I'm predicting that this kind of medicine is going to be very expensive. And until the healthcare system of all countries, of all nations, become one, and with one standard of care, then we won't be able to use this kind of innovations in the future. Poverty is one hindrance to such kind, and I think if we can address poverty, then we can promote this kind of precision medicine in the future. I totally agree, because you're getting DNA samples from patients, and you're collecting data, and one problem that we see on this is, of course, the Data Privacy Act and the ethical issues surrounding this kind of innovations. But of course, in the end, people will see the benefit. The benefits usually will outweigh the risk that you are afraid of, and in the future, it's quite promising for me. I'm very interested. We're trying it in some of the doctors already, but nobody wants to submit samples already, whether you will benefit from ACE inhibitors or ARB or aspirin versus clopidogrel or beta blocker. Nobody wants to submit samples of their saliva, and from there you can actually see already which drugs you can use. And if ever you are prone to myocardial infarction or perhaps atherosclerosis in itself, we are not we're not yet into that because we're reluctant to submit samples. So I think that's one hindrance. Social, the society, the acceptance, right? Acceptability in the community and the society. Um, Second is the interpretation. How accurate is the interpretation of such precision medicine? And fourthly, of course, the how doctors are, or how the healthcare system can deliver such kind of care to the whole community, especially in the developing countries. My message to the medical community is that much of the risk that we see in the community right now in all over the world, is related with lifestyle, and the lifestyle is dictated by the economy and global progress. And as we progress, we will be immersed into a lifestyle risk factors, and that's the price we have to accept for trying to progress. And by progressing, we develop certain intervention that will reduce the risk that we got from progressing. So it's a cycle. It's a cycle that we get into and ultimately end up exiting with, I don't know, a longer life or a better quality of life. So in the end, prevention, I think, is the key to all of these problems that we are seeing. But prevention is something related with lifestyle, and lifestyle is hard to change.